Physical function and aging. Why does function matter as we age? The objectives for this lesson are to comprehend the impact of physical function on aging adults who are unable to walk, stand and go, or get up from a chair, and appraise the Go for Life attitude to improve physical function and balance, and to understand the impact of a fall on an older adult and how it could be done, what can be done to prevent a fall. Those who are aging list the ability to physically function as the most important factor to maintain their independence, such as walking, driving, shopping, and personal care. One of the major health problems facing those who are aging is decreased level of physical functioning. 42% of aging adults have functional limitations or disability, and the number of disabled are increasing due to the obesity epidemic and living longer with chronic conditions. Disability can lead to inability to carry out everyday activities, falls, poor quality of life, hospitalization, and nursing home placement, and unfortunately, in some cases, even death. There's no common definition, but physical function healthcare definition is simple physical movements to more complex activities, ranging from the basic, like walking across the room, to the complex, like playing tennis. Actions can be termed essential if they are needed to maintain independence in living. Functional limitations include difficulty with grasping and fine manipulation of objects due to pain, locking, or both. Fine motor problems may include difficulty with inserting a key into a lock, typing or buttoning a shirt, or gross motor skills, which may include limitation in gripping a steering wheel or in grasping tools at home or at work. As you can see, all the way from playing tennis to being able to walk, physical functioning is very important to healthy aging. The World Health Organization has a life course approach to healthy aging. The right to the highest attainable standard of health for all people is enshrined in WHO's Constitution and in the United Nations Human Rights Framework. A life course approach to health optimizes the functional ability of individuals throughout their life, enables well-being and the realization of rights, and recognizes the critical interdependence of the individual, intergenerational, social, environmental, and temporal factors. The main outcome of the life course approach to health is functional ability, which is the sum of the individual and environmental attributes that enable a person to be or do what they have reason to value. Functional ability enables well-being at all stages as interdependent with the realization of rights. Here is a depiction of the different life stages from birth to older adult and how you function within those stages. So what are activities of daily living and instrumental activities of daily living? Physical function includes ADLs and IDLs. Together, they make up the skills a person generally needs to successfully and safely live independently. A person's ability or inability to perform ADLs and IADLs is used to gauge their need for care and or occupational or physical therapy. So just to recap, ADLs are activities of daily living, where IADLs are instrumental activities of daily living. ADLs are typically basic self-care skills that people learn during early childhood, such as sitting, standing, walking, and watching TV. IADLs are more complex tasks needed for independent living, such as cooking, housekeeping, and doing laundry. ADLs often include physical or postural activities whereas IADLs include activities that require a combination of physical and cognitive capabilities. And as you can just imagine, both are needed for healthy aging. So in regard to ADLs, when a typical person gets up in the morning, they sit up and throw their feet over the edge of the bed. Then they stand and walk to the bathroom. They take care of toileting, then shower, brush their teeth, and many other activities to prepare themselves for the day. When it comes time to think about food, they plan a menu, shop for the foods they want to eat, and prepare their meals. Next, they sit down to eat, and after the meal, they clean up the kitchen and wash the dishes. All these activities and many others are referred to as activities of daily living. ADLs are routine activities people do every day without assistance. There's 6 basic ADLs: bathing and showering, toileting and toilet hygiene, eating and swallowing, functional mobility, getting dressed, and continence. ADLs are basic tasks of daily life that most people they're used to doing without assistance. The ability to perform ADLs is used to help determine medical status for health coverage and long-term care decisions. Assisted living facilities and in-home care providers and nursing homes specialize in providing care and services to those who cannot perform ADLs themselves. Being able to perform ADLs while aging is directly linked to independent living. In regard to activities of daily living in elderly Americans, the probability of becoming cognitively impaired or disabled in at least 2 ADLs is 68% for people aged 65 and older. 42% report some sort of a functional limitation. 18% have difficulty with 1 or 2 ADLs. 5% have difficulty with 3 or 4 ADLs, and 3% have difficulty with 5 or 6 ADLs. So, in almost every way, people that are aging have difficulty with ADLs. In healthcare, we use what's called an Adl Assessment to determine need for help. This is an example of one tool that's commonly used, the CATS Index, where you look at mobility, bathing, dressing, toileting, transferring, continence, feeding, and determine the total points to identify independence or dependence and the need for help. So IDLs, or instrumental activities of daily living, are skills and abilities needed to perform certain day-to-day tasks associated with an independent lifestyle, which, as you can imagine, is much desired for healthy aging. These activities are not considered to be essential for basic functioning, but are regarded as important for assessing day-to-day quality of life and relative independence. It's estimated by 2030 there will be 5 million Americans over the age of 65, and it'll be 20% of the total population, with the 85 and older group growing significantly. Being able to accurately and adequately assess an older adult's competence with IADLs will be of the utmost importance in providing quality and timely care to this rapidly growing sector of the population. An evaluation of a person's ability to manage IADLs is often used as one of several factors to assess whether an individual can safely continue to reside in their own home without assistance. IDLs are the ability to use the telephone, do laundry and dress, shop and run errands, transportation like driving or knowing how to take a taxi or an Uber, meal preparation, self-medication management, doing housekeeping activities, and the ability to manage finances like use a checkbook. Fall prevention is also very important for healthy aging. Although it may not seem like a lively topic, it's very important. As people get older, physical changes and health conditions, sometimes the medication they use to treat those conditions, make falls more likely. In fact, falls are a leading cause of injury among older adults. Still, fear of falling doesn't need to rule someone's life. Instead, 6 simple fall prevention strategies can be used. Make a doctor's appointment to begin a fall prevention plan. Keep moving. Be physically active so you can go a long way towards fall prevention. Wear sensible shoes. Consider changing footwear as part of a fall prevention plan. And remove home hazards. Take a look around in each room. Make sure there's nothing to trip on or things that you could possibly see that would be a hazard for falls. And use light in living spaces to keep it brightly lit to avoid tripping on objects that are hard to see. And sometimes assistive devices such as a walker or cane are needed to keep people steady. Fall prevention is a key component of healthy aging. So to support healthy aging, maintaining function allows them to continue to live independently in their own home for a longer period of time. This can increase overall happiness and well-being and help cut down on costs over the long term. Here are some things that people can do for healthy aging. Exercise daily. Research shows that seniors can reduce healthcare costs, remain active, and reduce hospital admissions, all by being physically active. Even a walk around the block has been shown to be incredibly beneficial to helping seniors keep their mobility and ultimately their independence. Complete puzzles. Research has found that those who complete brain-stimulating puzzles such as crosswords and word searches approximately 4 times per week can reduce their risk of dementia up to 47%. Then focus on nutrition. A healthy diet is key to overall health and longevity for elders. Eating nutrient-dense foods such as seafood and lean meats, green leafy vegetables, and healthy fats from foods such as avocados and olives are all excellent ways to support good health, ultimately helping increase the senior's independence with daily activities. And accept help. This could be as simple as hiring someone to aid in tasks such as running errands or preparing meals. A lot of people have help with housekeeping. All of this is to support healthy aging. There's many benefits of exercise for healthy aging. It prevents disease. Studies have shown that maintaining regular physical activity can help prevent many common diseases such as heart disease and diabetes. Exercise improves overall immune function, which is important for seniors as their immune systems are often compromised. Even light exercise, such as walking, can be a powerful tool for preventable disease management. Improved mental health. The mental health benefits of exercise are nearly endless. It produces endorphins, the feel-good hormone, which act as a stress reliever and leaves you feeling happy and satisfied. In addition, exercise has been linked to improving sleep, which is especially important for older adults who often suffer from insomnia and disrupted sleep patterns. Another benefit is decreased risk of falls. Older adults are at higher risk of falls, which can prove to be potentially dangerous for maintaining independence. Exercise improves strength and flexibility, which also helps improve balance and condition. Reducing the risk of falls. Seniors take much longer to recover from falls, so anything that helps avoid them in the first place is extremely important. Another benefit of exercise is social engagement. Whether you join a walking group or go to group fitness classes or visit a garden club, exercise can be made into a fun social event. Maintaining strong social ties is important for aging adults to feel a sense of purpose and avoid feelings of loneliness and depression. The key is to find a form of exercise you love and it will never feel like a chore again. And the final benefit of exercise for healthy aging is improved cognitive function. Regular physical activity and a fine-tuned motor skills benefit cognitive function. Countless studies suggest a lower risk of dementia for physically active individuals, regardless of when they begin a routine. So, as you can see, there are numerous benefits of exercise for healthy aging. In summary, those who are aging list the ability to physically function as the most important factor to maintain their independence. One of the major health problems facing those who are aging is decreased level of physical functioning, and evidence-based interventions can be used to ameliorate the impact of disability and improve quality of life to allow individuals healthy aging. Thank you.